A month ago, I thought the coronavirus would be an interesting topic for us to talk about. And it's fair to say, I have no idea quite how interesting this was going to become. I've made up this presentation, and I've made it relatively basic because I think there's a lot of people that don't understand even the difference between a virus and a bacteria. I'm always having people come in with a viral illness and they want an antibiotic for it. So a virus is an intracellular parasite, much smaller than bacteria. It lacks the ability to survive and reproduce on its own. A measles virus is 8 times smaller than E. coli. That's the one that gives people a urinary tract infection. Hepatitis virus is 40 times smaller. This is an electron micrograph of a virus. It's what it looks like. Now, the coronavirus doesn't actually look quite like this. Matter of fact, Corona Beer has been so worried about this virus that they thought about changing the name of their beer. So, Dean, I don't know if you can see this, but that's Ebola Extra. What is the coronavirus? You can see here a pictograph of a coronavirus. You see these little appendages that allow it to attach to cells and open up a cell membrane. There's a surrounding area on it of lipids, that's fats. And those fats are necessary for it to penetrate into the cell, which is why the best treatment for this is washing your hands because it dissolves the fatty layer on the outside. Inside, it's an RNA virus that uses reverse transcriptase to actually hijack a cell's machinery so that it will make more virus and not do what it's supposed to do. So this is named after the typical appearance of a corona around the virus. It's a large family of viruses causing disease in animals, mainly camels, bats, cats, and men. It's usually just a mild upper respiratory disease unless it switches from one animal to the next. They call that zoonotic spread. There's different pathological expressions that include the Middle East respiratory syndrome, severe acute respiratory syndrome, and COVID-19, which is coronavirus disease in 2019, which is what we're facing now, COVID-19. Initial cases were linked to a large seafood and animal market in Wuhan, China, which suggested a zoonotic origin, and in truth, that's what it was. It came from bats, the same as SARS did. The Chinese authorities initially reported no spread of a disease, and again, this was a political thing. It was during the Lunar New Year, which is the very biggest event in the biggest Chinese holiday of all. And it happened in a huge city. So this is Hubei province, the capital of which is Wuhan, China. And Wuhan is a huge city. It has lakes in it. It's separated by 2 rivers, the Han and the Yangtze River. It actually encompasses 3,280 square miles, which is a huge city, 11 million people, 9th biggest in China, much bigger than New York, So this COVID-19, which is the coronavirus we're talking about, is more infectious than MERS or SARS, which is why we're more worried about it. But it's not as fatal on a case-by-case basis. You know, the mortality rate, and this slide has been changed about 4 times. All the slides in here basically have been changed a couple of times. Mortality rate, we think, is around 1%. The reason we don't know that for sure, and the initial rates were said to be 3.2%, the reason we don't know it is we don't know the denominator. We don't know how many people are infected. If we did, we'd know the mortality rate. It causes critical disease in 5%, severe disease in about 15%, and 80% get a mild disease, as opposed to something like SARS, which would kill 9.6% of the people, which would be almost 10 times worse than COVID-19, and MERS, which kills 35% of the people. But they're not very infectious, so they can't spread. So they were epidemics, but not pandemics. So another part of the slide I changed, initially this was less infectious than seasonal influenza. Now we know it's actually somewhat more infectious than seasonal influenza. And seasonal influenza last year killed 18,000 people in the United States. 310,000 people required hospitalization. COVID-19 has 10 times the mortality of a seasonal flu, 10 times worse. In flu, in children, flu is much more dangerous. It kills young people, it kills old people. Coronavirus in children tends to have only mild or no symptoms at all, which makes it very scary for Kiwanis people because we deal with children. And which children have runny noses? All of them do. And so if they have no symptoms or this, they can pass it to an older person and they can die from it. And both the coronavirus and the flu are most dangerous in people older than 65 or those with chronic disease or weak immune systems. That doesn't mean that they're the only people that are hospitalized. How is it spread? Close person-to-person contact within 6 feet is the most likely way to do it. It's via respiratory droplets with a cough or a sneeze. You need to avoid touching surfaces that are contaminated. But that's not the main way. That's a big concern for people because a lot of people now are ordering groceries and things like that and doing things over the internet. Contagiousness and sickness tend to coincide, and it may spread up to 5 days before you see any clinical illness. So Dare was concerned about this because he sat next to a person apparently at his granddaughter's recital that tested positive. And it could be 5 days before he shows anything or before that person showed anything. It's viable in air for up to 3 hours. That's important if you're thinking about flying someplace, if the air is constantly recirculated. If it's on copper for 4 hours, cardboard, it might last for 24 hours. So if you get a cardboard package in, then what you want to do is bring it in and set it down, then go wash your hands. You'll be fine. Let it sit for a while. Plastic or stainless steel, 72 hours. And nobody's done any studies on this, so these are all approximate. Nobody actually knows. You wash your hands frequently for at least 20 seconds to prevent this. This is the best way to prevent this with soap and water. Remember, the soap dissolves that lipid layer. If it's not available, then you use an alcohol-based hand sanitizer. But the best way is to actually wash your hands. And how long is 20 seconds? If you were to sing, "Happy birthday to me, happy birthday to me, happy birthday, dear Bobby, happy birthday to you," twice, that's about 22 seconds. So yeah, you can sing me happy birthday, wash your hands, and you're going to be fine. When you sneeze into your arm or a tissue, and then you throw a tissue away. If you have to fly on a plane, then turn the air vent on full and direct it away from you, not onto your wife. Wipe down the armrest and tray table with a sanitizing cloth before you sit down or put your hands on them. What do you think about masks? Well, some antiviral masks won't work very well at all. That one probably won't. But this one actually won't work too to prevent you from getting the disease. It won't prevent you from getting the disease. If you can't buy hand sanitizer, you can make your own if you need it. Keep some in your car. I know David Sampson does this all the time. He's never without it. And be careful about touching your face. Be careful about touching your face unless you've washed your hands. So make your own 60% rubbing alcohol, 40% aloe cream. You can buy those at Walmart. sometimes. Uh, Avoid close contact. This is how you prevent it. Stay away from people. Avoid touching your nose, eyes, or mouth. Hard for me because I have allergies and I always want to touch myself. But stay home when you're sick. Wear a mask if you're sick. That's the time when you wear a mask. If you are sick, you wear a mask to avoid spreading it to other people, not to prevent you from getting it. Here's one about a mask. This morning at the post office, while I was in line, two people with masks entered. Total panic. Then they said, "This is a robbery." And we all calmed down. Boy, usually I get a better response than that. What are the symptoms? The symptoms are just like the flu. You get a high fever, maybe 103 degrees, a cough that's non-productive. I told that to my wife and she didn't know what a non-productive cough is. It's a dry cough. Nothing's coming up. And shortness of breath. You know, I changed this. Craig told me nobody knew what SOB meant, but it's shortness of breath. Occasionally sore throat, headache, muscle aches, those types of things. This is thought to occur 2 to 14 days after exposure based on MERS. Now, I've heard various other times, but most of the information on these slides comes from the Center for Disease Control. And if you go to different places, you will find out different answers, but I would go to the CDC for this. Welcome, Michelle. I'm glad you're here. So, treatment. There is no specific antiviral treatment for COVID-19, none. It's symptomatic care only. May require hospitalization. CDC is working on a vaccine, and it could be ready in a couple of months, but it won't be available for widespread use for at least a year. So no matter what you hear, listen to a CDC about this thing. Will it go away when the weather warms? That's what happens to flu. Will it work with this? Well, you don't know. Nobody has any idea if this is going to last a long time. Some people think it won't last long because it was made in China. What's going to happen if you test positive? If you're positive and you're not short of breath, they're going to send you home. Self-isolate for 14 days. After 14 days, if you don't have a fever, for 3 days, you can return to normal activities. If you have severe symptoms, you'll be hospitalized. Maybe. What's the difference between an epidemic or a pandemic? Epidemic is like with SARS. It's a severe disease that attacks many people at the same time and spread through several communities. A pandemic spreads throughout the entire world. An example of that, Black Death changed the course of history in Europe. In 1346, it wiped out 1 out of every 3 people in Europe. It killed 25 to 30 million people at a time when there weren't that many people around. Justinian plague was also caused by Yersinia pestis, that's bubonic plague in 541. Antonine plague was caused by measles and killed a lot of people. Now, the worst plague ever was the Spanish flu in 1918. If you remember, the First World War had just ended. The First World War killed 17 million people, the war to end all wars. The Spanish flu killed 50 million people, much, much worse than the First World War. That's what we're trying to avoid now. People didn't know about respiratory isolation and things like that. Asian flu killed about 2 million people. This slide showed where it was a week ago. And it's moved on quite a lot since then, quite a lot. Okay, the elderly are at greater risk of severe disease than children, especially those with a weakened immune system. If you have heart disease or lung disease or diabetes, then you better stay away from this virus. You need to stay at home. If you're greater than 65, I would stay at home too. How do you diagnose it? This is one of the problems we've got and why we have to take such draconian measures now. The World Health Organization had kits developed, but again, politically we did not want to cause a great panic in the United States. So we said, well, this is probably not a big American problem. Don't worry about it too much. CDC, you go ahead and develop some kits. Well, CDC developed some kits that didn't work the first time, and they didn't develop very much at all. So we were very slow at testing, and it spread and it spread. This slide's a week old. A week ago on Thursday, they'd done 500 tests in Florida at the same time that they were doing 10,000 tests a day in South Korea. So this is this was a problem. Governor DeSantis, bless his heart, we went to the civilian industry and they can turn these things out. We ordered 625,000 kits from Quest. We got 250,000 kits in last Friday, and I received the first test in my clinic last Saturday. That's what the test looks like. COVID-19, it's a nasal swab. Very simple to do. Unfortunately, it takes up to a week to find out about it, but that's what it looks like. You can also diagnose with blood or sputum sample. There's characteristic findings on a CT scan. So what you have to do now is develop an action plan. During a COVID-19 outbreak, you want to avoid large gatherings, and now they don't want you to gather in more than 10 people. Before, a large gathering was 50. Good hand washing technique. Remember that song. Don't touch your face, nose, or eyes. Avoid going out as much as possible. You can order groceries in. Make sure you've stockpiled food and meds. And here's a very important thing. Think about the buddy system. This is one of the reasons a lot of people joined Kiwanis. You know, you've got a lot of friends here, but a lot of these friends are older. If you remember, several years ago, I started a remember committee that Cleo Hill does, where he calls people up. Anybody can do that. Call up older people and check on them and see how they're doing. Social distancing is not the same as social isolation. That's a quote from Beth, and she's absolutely right. You know, you have to think about this. Think about people like Padre and Joan and those people that are by themselves. Is there something we can do or need to do to help them? Call them up so they're not just stuck in a house. Why is this so important? I mean, 30 people died of a flu in Gulf Breeze and 1 died of COVID-19. Here's why. Here's why all the panic right now. We have to slow the spread. Johns Hopkins estimated there'd be 38 million people in need of medical care. 9.6 million need to be hospitalized, and 1/3 of those might have to go to the ICU. And in the United States, we only have 925,000 hospital beds, and they're 2/3 full. So where are we going to put those people? This is not like when I was on a submarine. You can't hot plunk people in a hospital. It's just not going to work. And so we don't have enough beds. We don't have enough ventilators to do this unless we're able to flatten the curve. If we can spread this out over time, then we won't end up like Italy. Italy have people dying all over the place, and they're dying. As a matter of fact, as of today, the number of deaths in Italy has exceeded the number of deaths in China. And Italy is what we're looking at, because they're where we were. They're 2 weeks ahead of us in the same thing. So that's why we have to really look out for this. We may be slightly more lucky in Pensacola because the Navy Hospital is absolutely empty. It has 310 beds. I was walking a dog the other day, found out that all those beds are in great condition. They're in great condition. I talked to the facility manager for the Navy Hospital. They're all empty. They're all in good condition. Not just that, but also we have tent hospitals but they deploy, rapidly deployable medical force. I was in charge of one of those once. Uh, what do you do if you get sick? Number one, stay home. Don't spread it around. Wear a mask. Call your healthcare provider, and he'll direct you for screening. If you don't have a healthcare provider, then you can get screened through Sacred Heart. Call that number. But now, why don't you just go and get tested for it? Because there's not enough tests to test everybody. So there's a pre-screening they do on the telephone before you are directed to the drive-through screening. Baptist has at least one urgent care that I know of, I won't tell you which one, that they will direct you to, and they're all set up to test you right there. Just call that phone number on the screen. If you're really short of breath, you better call 911, because that's what people die of. It's lower respiratory pneumonia. As of this week, we're going to have 2 more places. A community health center of Northwest Florida, which is a joint thing between Baptist and Sacred, is setting up a drive-through. Baptist drive-through will be up and running this next week too, and we should get more test kits in. This is a screening criteria. This came from the Escambia County Medical Society that was sent to me. So if you have symptoms of acute lower respiratory illness, that means you're short of breath, you're coughing, etc., and you meet any of these other criteria, and you don't have to remember any of these things. When you call either one of those 2 numbers, they will ask you those questions directly. And if you meet those criteria, they will direct you to a center where they can test you. So for our Kiwanis Club, all the meetings are canceled until further notice. And we could do virtual meetings, but judging from the amount of people showing up for this one, it may not be good. But golf tournaments moved to May 9th. Easter service is canceled. Easter egg hunts canceled. Reading to kids is canceled. I think Mike was thinking that he was going to do it in April. The schools are closed till April the 15th. Ark in the Park is postponed. So this is a quick quiz. And I have to tell you, if you guys flunk this, then we're probably going to transfer your membership to Rotary. That's it. So who do you get your information from on the COVID virus? Do you get it from a politician, local or national, if you watch the news? Your neighbor who heard some things? Your Uncle Louie, who used to be a corpsman? Or a Center for Disease Control? Hopefully nobody missed that. But if you did, here's the answer. cdc.gov. That's the best place, single place. It's updated every single day. And I've been watching this site so I could do this lecture. So, any complaints?